The MRCGP CSA is a challenging exam, making up one part of the requirements to complete GP training in the UK. In this series of videos, I'm going to go through some of the key tips that will help you prepare for and pass the exam. It's split into 10, okay, so let's start with the first step, and that is to understand the basics. So the exam is a simulated surgery. There's 13 cases played by simulated patients, and with each case you'll have a different examiner. You've got 2 minutes reading time before each consultation, and then exactly 10 minutes to actually complete as much of the consultation as you can. The examiner will be assessing 3 domains in every case. They're data gathering, clinical management, and interpersonal skills. And for each of these domains, there's a possibility of 4 grades. Clear pass, which is worth 3 marks, a pass, which is worth 2 marks, a fail, which is worth 1 mark, or a clear fail, which is worth no marks. Now, the total score from all 13 cases is all that will determine whether you pass or fail the exam. So, for example, if you do poorly in one domain in a particular case, you can compensate by doing really well in the other domains. Or if you have a really bad case, you can do really well in some other cases to make up for it. And they adjust the pass mark each day to take account of how difficult were the cases on that day. Usually it's going to range somewhere from around 72 to 78 out of 117, which is the maximum score. Tip number 2, join a study group. So forming a study group early on in your preparation, maybe, 9 months out or 6 months out before your exam, can help in lots of different ways. So, a good number to meet on any given day is 3 of you. So, one can be the doctor, one can be the simulated patient, one can sort of observe. It puts on that sort of pressure, it creates some of the nerves in the exam, but also to give some really useful feedback. Some candidates find that when they're being observed, they're behaving in a little bit of a different way. And so having that simulation, having someone who's watching you, can help you overcome that pressure and get used to it. But also when you're being the examiner in the group, if you've got a clearly defined mark scheme, actually you observing and giving that feedback can also help you learn what are the things that you need to do and things that you need to avoid, and the importance of actually clearly demonstrating all the criteria. It can be helpful to work with doctors with a variety of backgrounds and different styles, so you get different perspectives, and that you also don't get complacent. So while 3 of you might meet in any given day, try to have a broader group so you meet with different people at different points so you can get different perspectives. That can be really useful.